kitchen here, and you're more than welcome. We have Thai country this evening, Councilor Chenoweth's favorite. And with that, we'll begin. Hand the mic over. Okay. If that's all right.
Of course, yes. Is this far enough away? Am I good for everyone? Okay. Hi, good evening. My name is Emily Johnson. I serve as a community health supervisor at Yamhill Community Care.
Recording in progress.
And now we're recording. I was asked to come here today to talk a little about the work that we've been doing around a community health assessment or a community health needs assessment, depending on who you're asking. So I will talk a little about the process that we went through and talk about some of the findings that we have so far. And then I'm really hoping more of this is a conversation than it is a presentation, because I would really love to hear from each of you kind of how this data resonates with you, whether it reflects what you're seeing in our community. And I also would love to kind of pick your brains for any resource ideas that you have or any momentum that you're seeing in some of the topic areas that we've identified, so that we can start addressing them and putting some resource on our end towards those things. Okay, so to get started, this was a collaborative community health assessment. So I am representing Yamhill Community Care, which is the Medicaid or OHP health plan that serves people in this area, so Yamhill County and then little parts of Polk and Washington County. We also serve as the early learning hub, so we coordinate early childhood services for people in the area. We do lots of kinds of other things, but those are really the core components of our work. We also partnered with Providence Newburgh Hospital and with Yamhill County Public Health. So all of our agencies are required to do some sort of community health needs assessment. And in the past, we've done them kind of parallel and often overlapping. And so this year and last year, we partnered together to really share resource, to avoid over-surveying people, asking the same questions twice, and also really be able to share some of the data that we have access to with each other. So we were able to really talk specifically about, say, YCCO members and some of their demographics that Providence or public health might not have access to. We got to look at some really nice public health data that we wouldn't have otherwise had available. And we just had a lot more staff. We had a bigger team to do this work, which was really lovely. Okay, next slide. So eventually there's a next slide, no worries. This is kind of our timeline. I won't go into too much detail about the process. It's a big, long, it's called the MAP process. But we actually started September of last year. So this has been a really significant, long-term effort with lots and lots of people and resource involved. So we started planning. We had to figure out how to kind of work together as a collaborative, and then really started engaging the community at the end of last year. I'll talk a lot more about what that looked like, but for us, this was a major component of this process, was really to go out and get information from the people who live in this county. So we had kind of a 3-month, it sort of stretched into June, but it was this big, long engagement process to get as much feedback as we could about what's happening locally. And then really through the rest of this year, we have been finalizing this 79-page document. It's in kind of its mostly final stage, and I'm happy to share that with the group. It's a hefty read, but we think it's got a lot of good graphs to break up all of the narrative. But really what I'm bringing today is our next stage of community engagement and also just education that this data is available and it can be used. We have this document that kind of shares the highlights, but we also have tons and tons of additional data that really I would love to make available if people are curious about some of the things that we found. So for the next couple of months, we're going to be bringing some of this information back to community groups, and that includes both groups like this, who are really kind of experts in communities that they serve, and also individuals who often are the ones served. So we're really trying to understand all of the ranges of perspectives in this community. And then we'll write another really, really long document that will have all of these strategies that are hopefully going to be feasible and impactful and based on data to really direct resource and efforts to fixing some of the barriers and needs that we see locally. Okay, that was a lot of process. Our goals, just really high level, so we all have a foundation, they're on the next slide, are really to collect and analyze and synthesize as much information about this community as we can, really engage the community in that process. It's not just looking at census data and health plan data and making assumptions. It's really asking people what they need and figuring out how to kind of meet in the middle, and then to create this big, long document, ultimately. Okay, so, all right. I will dig into our process a little bit. I would welcome questions, interrupt me, ask me if there's anything that you're curious about, or, hey, did you do this? I think that would be important. I'm very open to being stopped and paused and questions. Okay, so as part of this process, we follow a pretty prescriptive kind of public health process. And it involves really going to the community and asking different kinds of questions in really structured ways. So we did 13 stakeholder interviews. Those are with a variety of community agency leaders. So we went to representatives from all different kinds of nonprofits and community-based organizations. We went to remnant initiatives. So we asked about the experience of people who have been incarcerated. We went to Unidos, so we asked about the experience of immigrants and Latinx individuals and Spanish speakers. We went to school leaders and all kinds of different people. I can talk in a lot more detail there if you want. And then we did listening sessions. So after talking to the people who really address needs, we talked to the people who have the needs. So we went to schools, we talked to high schoolers, which was really fun. We went to homeless shelters and we talked to veterans. We really tried to capture as many populations as we could that often aren't heard as much. And then we did a big, big survey. So we had a little more than 800 community health survey responses. And from that information, we're actually able to draw some decent conclusions with that kind of sample size. It's not scientific, but we think that we have some really interesting information. Okay. Then we looked at all kinds of secondary data. So this is census, the behavioral health risk assessment surveys, and all kinds of kind of public health data. We have tons of really interesting COVID data that we looked at. As much as we could, we tried to stratify things by demographic. So if we're looking at income, do we know if different races are making different amounts of money? Because we can only draw so many conclusions about the whole population unless we're really looking at specific subpopulations within there. A lot of times that information isn't available. We found especially LGBTQ kind of status was really hard to find because the census doesn't really collect that. And so there were some times when we really had to step back and look at things like national data and try to make some correlation, or we had to look at our community health survey and say, this isn't perfect, but this is information that we have, and we're trying to better understand our population. So there are a variety of limitations that I can certainly talk about, but I think one of our big focuses is really that lens to understand, here's a need, but then which populations are being most affected by this need, which populations have been affected historically or generationally by this need, and are there different ways that we can meet a need based on that population? So that was really a lens that we tried to use and that we're continuing to try to apply. Okay, next slide. This is the slide we'll spend the most time on. These are the main themes that came out of our conversations with the community. This isn't every single need in the community, we know that, but these are the things that really rose to the top. These are the things that people talked about the most in listening sessions. These are the things that were ranked the highest when we did surveys, and I continue to hear these themes as we have these conversations. So if there are things that you're just baffled aren't on this slide, please let me know. I know things like childcare come up a lot, and we see that. And as the Early Learning Hub, we definitely have strategies to address those things. But there is always space to say, hey, this is definitely missing. But these are the things that we're hearing. I'm assuming none of them feel surprising. I can talk a little more through them, but really I'm very curious about kind of how these resonate, where you're sensing energy already in what you're hearing from community members. I think you all have some insights into community voice and opinion that I don't necessarily have as somebody from a health plan. So very curious about that. 627, okay. I'll talk through these just a little bit. Again, please interrupt me. Please add things to what I'm sharing with you. So housing, these aren't in any particular order. And housing comes first, somewhat for a reason. So one of the really important things that we heard about housing is just how significantly broad the housing issues span. So we went to homeless shelters and talked to people who are literally homeless. And I was also just talking to dental providers this morning who were saying, you know, I think the root cause of not having dental providers is that they don't have housing that they can afford. Even though they're dental hygienists and they're making good money, there's still not affordable housing. So when we do these assessments, I think we often look to low-income people as being the ones experiencing barriers, and housing just across the board is a barrier for people. So there's all kinds of data and graphs that I can share. Generally, you know, we know that there's a homeless count, and it is very underrepresentative of the true homelessness in Yamhill County. And even that was saying 79 children were sleeping outside on the night of the homeless count. And this was a rainy, chilly night. I was there. Not a lot of people were outside. And so I'm sure this is all really familiar to all of you, but I think that specific data point really hits home for me. And we talked to a lot of people who just said, you know, I was gonna end up addicted if I didn't get housing, or I couldn't find a place for my children to be. So there are lots of very personal stories that people can tell about their housing burden. But this is something that I can't speak for the other agencies, but YCCO specifically has really been looking at and trying to invest in and focus on. I'll move more quickly through the rest of them. So economic insecurity came up a lot. kind of in a interesting range of ways. So people talked about like job insecurity and COVID, being kind of a reason that people were losing jobs, but also that there isn't training necessarily, especially for people who are Spanish speaking. They feel like they don't have access to ways to kind of improve their employment prospects. Another point that a community member made was there are regular people who make at one point what was a reasonable amount of money, but now they're struggling and they don't know why. I've heard that reflected even among kind of people I spend time with socially. It's a very real thing. And then we, as always, try to kind of look at demographics. So income is pretty like middle of the road for Oregon in Yamhill County, but it's about like $63,000. Maybe someone here knows better than me. It's in my data. But when you stratify that by race, we see that at the low end of that income spectrum is $48,000 a year for American Indians. And then it goes up to $82,000 a year for people who are Asian and $69,000 for those who are white. And so that $63K a year number really doesn't reflect kind of the true range in this county. Okay, food insecurity came up. This was a really interesting one because people in listening sessions didn't necessarily highlight it as a big problem. I heard a lot from people that there are tons of free meals, there are tons of food pantries. If you want food, there are definitely places to get it. But what we heard from stakeholders was there isn't the right kind of food necessarily. It's not always high quality. It's not always culturally appropriate. We heard a story about a family who got this beautiful Thanksgiving dinner spread from a food pantry, a full turkey and all of the fixings, and they didn't know how to cook it because that wasn't culturally appropriate food for them. And so they couldn't really do anything with this beautiful giant meal that the food pantry provided. And so there was a lot of nuance in this one in the conversations we were having with people. We don't see a ton of food insecurity comparatively. So Oregon 2019 data, it's about 12% people who experience food insecurity, and in Yamhill it's about 10. That's still a higher number than it should be, but we're not outstanding in the state in that area. Okay, racism, discrimination, and inclusion. So this is one where we can pull a lot of data and we can have a lot of conversations. And we saw themes of people really wanting to take care of each other. That was a big, big theme that we heard. And we also heard a lot of concerns about specific populations. So lots and lots of worry about students and children. So LGBTQ plus students, especially the way that they feel in this community or in their homes or in their schools. People with disabilities, there was a lot of concern about accessibility and inclusion in kind of activities and available opportunities. And then concerns specifically about people of color kind of feeling included. Our Yamhill community survey asked whether people agreed with the statement, people of all races, ethnicities, backgrounds, and beliefs in my community are treated well. And 31% of people disagreed. That was a lot higher than some of the other disagrees in the questions that we asked. These are questions like, is this a nice place to raise your family? Is this a good place to get food? And most people largely agreed with those statements. And this question was kind of an outlier, that people disagreed that being different means you will still be treated well. recreation, people really want pools in their communities. That is a theme that I heard, especially those rural communities. We heard things about how McMinnville is a really wonderful, rich place with tons of opportunity and resource, and usually the activities available cost money. So that was something we heard a lot of, this is a beautiful, pleasant, clean place to live, and it's expensive, and I can't afford to do the things I want to do. I can't go wine tasting. So that was a theme. Rural areas are kind of a desert for recreation. We have a kind of map that shows the different walkability ranges, and it's really good in McMinnville and in Newburgh, and then in the more rural areas, it's not great. So there's kind of a lack in the county, in those smaller towns, of safe walkability. That said, our community survey respondents mostly agreed. 76% agreed or strongly agreed that there are pleasant places to be active near my home. So we really heard from people that they like living here and that it's a nice place to live. Okay, I didn't cover access to transportation. This one we hear a lot. We don't have great transportation data. So the Yamhill County Transit Authority did a really nice assessment, but it was quite a few years ago. And I think a lot of the issues that they identified back then are still relevant. And so we know things about commute times. It's like 26.2 minutes on average to commute in this community. But we mostly have information about people's experiences. So what we heard is, I can't get to the bus, the routes aren't as extensive as I would like, they're not as accessible as I would like if I have a disability, especially with mental illness. If someone feels really uncomfortable using that system, there aren't a ton of recourses for them, especially, again, if they live in those rural areas. And those were a lot of the quotes we have. If you live anywhere outside of McMinnville or Newburgh, it's really hard to get to where you want to go for whatever you need. Okay, jumping into health and wellness. Are there any questions or thoughts or comments? You're maybe done with your food now, so you can.
We're good listeners.
Okay, awesome. All right.
Practice active listening.
I've noticed, yes, I have had a lot of eye contact. It's wonderful. Okay, so health and wellness. We are doing a community health assessment, and so I think a lot of people expect this conversation to just be about healthcare access and quality. And really what we find is all of these social needs, one, are impacting people's health. If you're not safely housed, if you can't get to where you need to go, your health suffers. And we know that all of these needs are impacting the ways that people are accessing healthcare. So if they're feeling like they're going to be discriminated against, they may not go to a provider who is going to use the wrong pronouns or who is going to treat them differently based on what pain levels they are reporting. We know that transportation is huge for getting to especially specialty care, which often is entirely outside of this county. All of these things we know both really impact individuals' health, but also impact their ability to access the health care that they need. So I'm not supposed to really have an opinion yet, but I think homelessness and behavioral health are the things that really I have heard the most. People talked a ton about mental health, about not being able to kind of get the supports that they need, and also that their mental health was really suffering. So lots of conversations about feeling really isolated, feeling really lonely, lots of concerns about kids and children. That definitely came up a lot. People express needs for more mental health providers, things like detox facilities, substance use treatment, reducing the stigma around substance use and mental health, and then services specifically for specific populations. So the Latinx community, immigrants, making sure that undocumented people have access to the healthcare, specifically the mental health care they need, people with different kinds of disabilities. I heard something in one of the listening sessions about, mental health providers might treat someone with a disability as if their disability is the mental health problem, and things kind of get lumped together. So there were definite kind of specific concerns shared about specific populations. One thing that we found, we asked, do you know what to do if someone you know may hurt themselves or others? And a full fourth of people said no. This was another theme that we heard, is that we know there are tons of resources here. I mean, you're all in McMinnville. There are so many good resources, and people don't always know about them or know how to get to them or have to make a phone call, and that feels really hard, and so they can't access the services they need to access. There are so many layers to kind of behavioral health, which is substance use and mental health access, and we just heard a lot of people being really kind of worried about this in our community. Okay, so general access to healthcare services, similar things. Lack of providers is really the one that comes up the most. Making sure that the providers needed are appropriate for the needs that are being presented. So access, when we think about it, and what we heard is not only can you get to the doctor, cost was the biggest issue reported in the survey data. People can't pay for their doctor's appointment, but also can they get there? Do they have transportation? Is it at a time that works for them? Would they need childcare to get there? And if they can't have childcare, they can't go. But also, is it the appropriate provider? Is it the specialist that can treat your condition? Is it somebody who looks like you or can speak your language, or bring in an interpreter who can speak your language? And does that person have the ability to connect with you? Do you like your doctor? That is a real part of access to healthcare. Okay, home stretch, chronic conditions. We didn't hear a lot about these. People aren't sitting in listening sessions talking about how concerned they are about heart disease. Some listening sessions, but we know that the data tells us that these are the #1 killers in our community. Obesity is #1. We are generally a little higher than Oregon on average in obesity and diabetes, and then asthma, cancer, and heart disease are following. These are things that can largely be prevented, and largely with some of these social needs being met. Is an area walkable? Do you have healthy food? Do you have social supports to get what you need? And so we always just include chronic conditions because those are the things that we know are contributing to morbidity and mortality in a really intensive way. Okay, the last one is environmental factors. So again, people aren't necessarily talking a lot about the weather in the listening sessions, but we know that these are hazards that have been increasing. We've all kind of felt wildfire smoke in our communities, and we've felt the kind of weather events and earthquake risks that exist around us. And we know that people who have been marginalized or are low income or who have disabilities may be more affected by these kinds of things. So if there is an evacuation, somebody with a disability may or may not be able to get out in the same way as somebody who doesn't. We asked the question, do you feel like you are prepared for an emergency? And I may have to give you the real number in a second, but like 42%, a very large number of people said they didn't know what to do in an emergency, which feels very scary, knowing that Oregon is a place that can experience a lot of weather and natural disaster risks. Okay, 6:45, beautiful. Initial thoughts. I have more specific questions. You've been wonderful listeners, but any kind of initial reflections, things you want to counter or add or question? Yeah.
Well, there was a number of things. It looks to me from your discussions that food insecurity in some kind of has a lot of impact on what people are having. And here I thought we were actually pretty well covered in this area, but you're right. Probably, the obesity situation is probably largely due to that. I kind of ponder what we're serving in the soup kitchens and stuff, but that is a concern, and just being able to access and be able to cook food and things like that. Transportation is huge, and I, I certainly would agree that we need better transportation here. I don't know, these two things, as we went through here, seem to keep coming up in various ways with the wellness, health and wellness type of situation. I mean, I personally feel like homelessness and housing instability is probably a big one. I'm not sure what the economic insecurity and education and job skills all go together. I think that's a really broad topic. So, and the fact that people are making the same, but they're actually being able to have to live on a lower scale. It's kind of disturbing. But I just was particularly struck by your discussion of food insecurity and I knew access to transportation was going to be an issue.
Other members of council?
I have a question, Mayor. Thank you. It's great that the data is being assembled, and it sounds like there's a requirement to do that. My question is, after all the data is assembled and it's given to stakeholders and community partners, is the intention that community partners are going to step up and meet all of these needs? I expect that some of this data is not new.
Yeah, that's such a good question. We know that solving racism is not a strategy that we can necessarily write and achieve. But that really is the hope, and not that part, the hope that you said around identifying those community partners who can address some of these needs. So if you think back to that timeline, right now we're developing a community health improvement plan. And part of that process is understanding where there is energy around some of these things. So, okay, everybody knows that transportation is an issue. Who are the players who might impact that? And could we work together to make the system better? And sometimes that looks like maybe it's policy change or big system change. I think on our level historically, it's been, can we give a grant to an agency to offer gas vouchers to people? It really kind of spans the gamut of what is feasible at the time. So I would love to solve all of these issues, and I think that our CHIP is really aiming to chip away at it and try to address some of those things that we know we can address with the partnerships that we have. Did that answer your question?
Yes, it did. Thank you. I would be interested about the survey going to the next level. So just in terms of personal experiences, we had an experience with a foster child where a provider failed to leave a message after canceling an appointment. Like, they canceled the appointment, didn't tell us. We showed up. And for a child in foster care, you just disrupted their consistency, which they so very much need. And that tiny piece, of course, falls under behavioral health access. And so we were switched to another provider who was not trauma-informed, not inclusive to his developmental disability. Like, it was just sort of this vortex of yucky stuff. And it's just these tiny little experiences. And you touched on it with the appropriateness of services. Is that provider appropriate? And some of it could be trained.
Yes, yes, this is exactly what this information is giving us. I think that we can only look at numbers so much, but having data that is stories and specific experiences is how we make change that makes sense for the community members who live here. So we can talk about, let's do a big program to recruit a bunch of providers. But when we're hearing from community members, I had a bad experience with a provider who's already here, maybe the need is also about quality or training or certification of providers in the community already. So thank you for sharing that. And I know we can always do better, and I would love to think that this huge collections of stories like yours that we have is informing the way that we develop the strategies.
Thank you.
I have another question if somebody doesn't.
Go for it.
Okay. So I would love to kind of look to this group's expertise, if that's something I'm allowed to do, around, are there places where you are feeling momentum? Has there been a project around one of these topics that you've been working on, or an agency you work with has been working on? Are there areas that you're hearing kind of the voter base get really jazzed about? We want to kind of look at feasibility, and if there are things that are already happening or simmering in this community, I would love to know about them so we can focus attention on doing the work that is also more feasible as well as more needed.
I'll start. I'll take a stab on behalf here. And I wanted to add a little bit to the conversation on food insecurity as well. Not only did we hear a lot, especially during the pandemic, about food that wasn't culturally appropriate, but we also heard big challenges, especially from the school district, about sending out meals that people even had the ability to heat up in their homes. And so trying to put together food that can go home, but then it's not just knowing what to do with the food, but it was actually having, you might have only a hot plate or only a microwave or less than those things. So making sure that the food that was going home had a means of being prepared to an edible state. So to your question, I'll start with the economic insecurity, education, and job skills. So I know SEDCOR has been organizing a large workforce training program. I also know that, for instance, Unidos wasn't included in that workforce training up until maybe a month or 2 months ago. But that is a collaborative effort that was something that I started talking to a lot of different entities that were doing workforce training, and the more I talked to, I realized there was already a group working in that way. So that includes our school district, Chemeketa, Linfield, Water and Light, and a number of our other employers and nonprofits. And I think highlighting and continuing to invest in that work that's being done by those nonprofits. I know that Visit McMinnville now also wants to work on that workforce training program specifically for people in food and beverage industry. In terms of recreation and community building activities, the city of McMinnville did endeavor and start on a long-term plan for a new recreation center and community and aquatic center. That is currently on pause. However, that work has started. On access to transportation, we recently, through Senator Wyden, received $1.5 million to increase transit in Yamhill County. But that, I think the end result was that increased the number of buses, but wasn't enough money to invest in electric or to kind of take that next step towards sustainability and stewardship. And I think it was mostly replacing aging fleet. I don't know, Jeff, if you have a clearer memory than I do, but I don't think it really added many transportation stops. I always encourage everybody on my committees to take YCTA if you haven't had to try to plan and get somewhere. On racism, discrimination, and inclusion, the city did launch a Diversity, Equity, and Inclusion Advisory Committee a couple of years ago and has started to implement some of the some process reformation from that committee. For instance, the way that we do our interview process now for our different advisory committees. And then the council will also be doing DEI training for the first time during our council retreat this year. So there's that. And then homelessness and housing instability, throughout Yamhill County, I think we have over 400 providers total doing different types of services, but we're not networked together. And that's a very, very, enormous challenge when you have people focusing on these small areas. We are going to be making an effort to get in on the Oregon Mayors Association Homeless Task Force legislative concept that's going to the legislature in the short session, and councilors, you all received an invitation to attend City Day at the Capitol today, and we have a lot of needs, so I encourage you to think about attending that. But if we were able to do that, we would be hoping to partner with and bring in additional monies for existing nonprofits that are doing work that we think could make a significant impact. And we have a very, what at times feels like an insurmountable problem, even though we've taken a lot of good steps and we've done a lot of policy and program implementation over the last couple of years that has made an impact. The community is still, our overall community, housed and unhoused, very much suffering from the overall layers of that, including lack of housing at multiple income levels, and on behavioral health, not so much on the access point, but or maybe this is on the access point. We certainly are suffering a lot from some extreme behavioral health pressures that are coming up in our community that we don't really have the resources for. If we do, I don't know how to get them to those resources. So it's a big challenge. It's a big challenge that we are experiencing in our community outside of the other levels, the microaggressions that happen towards folks, but we are having a lot of challenging. We have a lot of challenges with that. That wasn't quite all of your points, but in terms of things that are going on, I hope that was a couple things that we have rolling that be good to share with you.
Absolutely. That was so comprehensive. Thank you.
Other councilors?
I just want to say that the summer program through Parks and Rec to include everybody and also the sensory inclusive swimming. So there's a lot that Parks and Rec is doing on the recreation and community building activities.
Sensory inclusive swimming.
And we have a mobile rec
Are you saying that exists, or that's an idea? That's
You want to talk into your mic so the good folks at home can hear you too?
Yeah, I would add, just on the workforce development, that's a comprehensive. MEVLC is also working on workforce development with the Noble Grant, and has brought Unitas to the table and various groups to try to push workforce development along. So just add that component as another area in the community working on that area.
What was that acronym again?
Sorry, MEV as in Victor, L as in Larry, C as in Charlie, stands for McMinnville Economic Leadership Vitality Council.
Close. You just switched 2 words.
Vitality, I don't know which one.
Well, it doesn't matter.
Leadership. McMinnville Economic Leadership.
Vitality leadership, yeah. We do have a lot of great partners working on a variety of things, but, and MEVLC is one of them, for sure. And MEDP, that's McMinnville Economic Development Partnership.
This has been fabulous. Thank you for sharing these things. I want to be really respectful of your time. It's 7:01.
Yes, we have to legally start our meeting a minute ago, you know.
Yes.
We also have our city-county dinner on Thursday, which I bring up because we will, at that dinner, we will be inviting representation from every single city, district, and the county, Confederated Tribes of Grand Ronde, all to present some of their, what they're working on. And in my ask of everybody that's presenting at that time, I'm specifically asking people to highlight some partnerships that, that they're working on. So, you know, let us know if you'd like to come.
We'll be in touch.
I'm hoping Claudia doesn't strangle me after the meeting, but we're
Well,
at
thank you so
67 with 68, you know.
Claudia has my email. If anyone wants to reach out with any other ideas, I also have a survey that you can really quickly share any of these priorities with me or any more information that you want to share. So that will be going out, and thank you so much for your time.
Thank you so much. We appreciate the presentation and information. I will now adjourn the work session at 7:03 PM. We will now go right into the City Council regular meeting. This is the council meeting of November 8th, 2022. I'd like to call the meeting to order and ask Claudia to do a roll call, please.
Counselor Geary is here, but not at the dais. Counselor Minke?
Here.
Counselor Chenoweth?
Present.
Counselor Payne? Here. Counselor Peralta?
Here.
Council President Garvin?
Here.
Interim Mayor Drapkin?
Here. And I will now ask if Councilor Chenoweth will please lead us in the Pledge of Allegiance. Thank you, and thank you to the community members we have joining us here tonight. We'd now like to hear from any interested audience members. Please feel welcome to provide comments, and any comment that's provided that requires some type of follow-up will be assigned to a staff member. Anyone may speak on any topic other than a matter in litigation, a quasi-judicial land use matter, or a matter scheduled for public hearing at some future date. Comments will be limited to 3 minutes per person for a total of 30 minutes. If you are on Zoom and you wish to speak, please use the raise your hand function, and we will call on you when your turn is up. You may also send a chat directly to our city recorder, Claudia Cisneros, and we will announce you. Is there anybody in the gallery that would like to make public comment this evening? Is there anybody on Zoom that would like to make public comment this evening? And is there anyone on the phone that would like to make public comment? We'll go to advice and information from counselors on committees and board assignments, and then to department heads for those reports as well. I'll start to my left this evening. Council President Adam Garvin, do you mind taking us away?
Thank you, Ms. Mayor, Madam Mayor. YCOM, we met today, nothing new really to report there, other than the West Valley and Grand Round are looking to enter into a 5-year IGA agreement, so that could shift dues a little bit. And then obviously our fire district, if that's successful in May and that offloads off the city, that'll change the due structure a little bit as well. Airport Commission, we had a good amount of interviews. We have 2 very qualified commissioners coming before us for appointment next council meeting, I believe. They'll bring some different diversity and perspective to the Airport Commission that we haven't seen before, so excited to see them be on board for entering into this master planning process over the next couple years. Visit McMinnville meets next week, and then we'll have that public hearing for the fire district with the county the first part of December. Thank you.
Thank you. Councilor Geary.
Thank you. MURAC met and we discussed the Downtown Association, and they brought forward a proposal to consolidate and construct a trash corral in the parking lot here between Cowles and Baker off of 2nd Street here, to consolidate the dumpsters and the like that already conglomerate there, and asked for some money to help with that, and the committee, after discussion, approved it. And the MDA was a great partner to all those businesses downtown, trying to beautify that and get that to work right. The downtown, then we spent some time talking about the downtown master plan, and that was about it on the MURAC. And then DEIAC will be meeting Thursday in the afternoon, where we'll hear from new HR manager Hedges, as well as hear a project advisory committee recruitment update and equity lens and public engagement charter update, and review the current subcommittees and have a discussion around that. And then that's it for my assignments, but I'm looking forward to next week's City Council School Board meeting.
Wonderful. Thank you. Councilor Chenoweth.
I have nothing to report.
Thank you, sir. Councilor Peralta.
Thank you, Mayor. Just a brief report. Council of Governments has hired additional grant writing staff, so we are making available to local jurisdictions low-cost or no-cost grant writing assistance, just FYI for city staff. And the most recent COG Connections had a really large number of grant opportunities listed that are coming up for deadlines in November, so just flagging that for staff's attention.
Thank you. Councilor Payne.
Nothing to report.
Thank you. Councilor Menke.
Other than the Construction Excise Tax Committee is meeting on Thursday, I don't think I have anything else to report.
Excellent. Thank you so much. Let's see, we have a couple scheduling changes at council, November 21st and December, and our last meeting in December are both changed, and as well, the McMinnville Affordable Housing Commission will be meeting a week earlier than regularly scheduled in December to create a little buffer around the holiday. As a continuation of Council President Garvin's notes on the Airport Committee interviews, it was my first time getting to do those particular interviews, and it was truly overwhelming, the amount of talent and knowledge and experience that that came out. We had 19 applicants. I think we actually started with 21 applicants. My numbers might be a little messed up, but they're right around there. And then 19 who went on to interview, although 2 that didn't, only because one person had termed out and the other person just declined to interview. So we did 19 interviews, and really we had 8 people that immediately had just such a plethora of experience. It was overwhelming, the amount of professional and individual experience. And I just want to say thank you to everybody that applied for not just that committee, but our other committees. We've also been interviewing for Affordable Housing Commission and Planning Commission, and we have Budget Committee interviews coming up, and we have more seats opening up as some terms come to an end. So this is just to say thank you, really a robust thank you to everybody that applied, and then to continue to invite you to keep on applying, because we will be having and have more openings coming up. The City of McMinnville has the opportunity to host the city-county dinner on Thursday evening, November 10th. So we are looking forward to doing that. We have a really nice guest attendance from every city in the county, other than Lafayette, who has a regularly scheduled council meeting on that night, and so they won't be attending. But otherwise, not just the cities, but also Chehalis Parks District and Confederated Tribes of Grand Ronde, and as always, we have good representation there from our state partners. So we're very much looking forward to that. And we'll go to department head reports. Mr. Towery, would you like to start?
Thank you, Mr. Mayor. Just expanding a little bit on Councilor Geary's announcement, in addition to your regular scheduled work session next Wednesday, you will be having a joint meeting with the McMinnville School District. The primary focus will be Parks and Rec, facilities, and the like. Presentation led by Parks and Rec Director Susan Muir. And just a reminder that other than our 24/7 operations, city operations will be closed this Friday in recognition of Veterans Day. For anyone who is here or listening who has served, I thank you for your service. And for those of you who have the opportunity to thank members who have served in the community, please take some time to do that over the weekend.
Thank you. Mr. Gebeisman, are you making a report this evening? Are you here for the ordinance later on?
No, ma'am, I'm here for the ordinance.
Wonderful. Thank you for being here. Always lovely to see you. Director Richards.
Yes, so good evening, Madam Mayor and councilors. Anyways, following up on the committee discussion, we are coming to the end of the year. That means we have committee openings and opportunities for people to apply. In the Community Development Department, we have 5 standing committees that work on work for the city that comes up to the City Council. We have 12 openings on them. Our committees are the Historic Landmarks Committee, the Landscape Review Committee, the Affordable Housing Committee, the Planning Commission, and the Urban Renewal Advisory Committee. It's a great way to get involved in city work. It's also a great way to know what's going on in the city before it becomes public information. If you want to know what businesses are coming in or development is occurring, these are great committees in which to learn that. If anybody's interested in volunteering for committee, you can find information online at our website, or feel free to contact me or the city recorder.
Thank you very much. Please.
Is are we still soliciting for the smaller one? I know Fox Ridge we approved, but the TSP, are we still soliciting for that?
Yeah, so we have 2 project advisory committees that we went out for solicitation on. We're still accepting applications for those. That's the Transportation System Plan update, and then our Housing Needs Analysis update.
Okay, thank you.
Thank you. Director Muir.
Yes, Mayor and councilors, on behalf of the Friends of the Senior Center, I want to make sure that you are invited to their Thanksgiving dinner. This is one of the social opportunities that we've been able to reopen at the Senior Center, and we're thrilled to do it. The date is Saturday, November 19th. It's at 1:00 p.m., and if you are interested in purchasing a $10 ticket, you can call the Senior Center or notify me, and I'll connect you. That's it.
Thank you.
Nothing to report. Thank you.
Okay. Thank you. That's our city recorder, Claudia Cisneros. And let's see. I believe I saw Other members of our executive team on, oh, yes, Director Pagano, are you on Zoom? Would you like to give a report?
Yes, I'm here. Thank you. Can you hear me okay?
We certainly can.
Okay, great. Sorry, my video won't let me show my face, but I'll keep trying. Start my video. Here we go. There we go. Hi. I have some exciting news to share. After a year-long search, I'm happy to announce that we hired our city engineer. So excited. His name is James Lofton, and he's coming from, thank you. He's coming from the city of Salem with a really great diverse background in both public and private sector work. So we're super excited for James to join our team, and he'll start around the 1st of December, and at that time, we'll do a press release with some more information. So that's all I have. Thank you.
Does he have a name that we can know
I'm
now?
sorry. I thought I said James Lofton.
Wonderful. Thank you. And Director Hedges?
Thank you. I have nothing to report this evening.
Thank you. We're now going into our consent agenda. Since we have just one item on our consent agenda tonight, I'd like to go through the consent agenda and then invite assuming it passes, then invite the appointees up to say welcome to the city of McMinnville. So first, I will ask for a motion to approve our consent agenda, also known as Resolution Number 2266, a resolution appointing members to the Affordable Housing Committee and Planning Commission. I have a motion from Councilor Chenoweth.
Second.
And a second from Councilor Payne. All those in favor, please signify by saying aye.
Aye.
And those opposed, say nay. And the consent agenda passes unanimously. So we have, I know we have I've seen at least one member on Zoom and one member in the gallery. Would you like to come up and introduce yourself to the council as a start to your service? No, that was a terrible idea.
Well, it's so funny, Mayor, because she asked me before the meeting if she would need to do that. I was like, no, it's a consent agenda. It'll be fine.
Well, we'll start with the gallery. Thank you. Thank you. Ms. Murray, if you'd like to introduce yourself to the council.
Thank you. My name's Meg Murray. I've lived in McMinnville mostly since, I believe it was March of 2006. I have 2 children in the community and 2 dogs now. Those are new. And I'm looking forward to just helping as I can and following ordinances and reading up and looking forward to the scale of the community and as well as keeping with the heart of it. So thanks for having me.
Excellent. Thank you. And then if we could go to Zoom, we did have 2 members on Zoom, although one just texted me they jumped out or something. But I see we have Michelle Pierce on Zoom. Would you like to introduce yourself to the council?
Hello. I don't know if you can see me. I'm Michelle. Can you hear me or see me?
We can. Thank you.
Okay. I'm Michelle Pierce, and excited to see Meg there as well. I didn't know, so that's exciting that we'll be working together. Yeah, I'm just really excited to be a part of this committee, and I'm really glad that I was chosen. I'm looking forward to it.
Thank you so much. And is Carrie Martin back on Zoom? If not, we will move on. Well, thank you both, and thank you for your willingness to serve. We will now move into our ordinances. We're going to consider the first reading with a possible second reading of Ordinance number 5126, an ordinance adopting the 3 Mile Lane Area Plan and its appendices as a supplemental document to the McMinnville Comprehensive Plan, and amending the McMinnville Comprehensive Plan, Volume 2, Chapter 6, Transportation System to add a proposal. Does any member need to declare a potential conflict of interest or recuse themselves regarding this ordinance? We will now consider the matter of ordinance number 5126. Does any counselor object to having the ordinance read by title only? Will the legal counsel please read the ordinance by title only?
Yes, Mayor. Ordinance number 5126, an ordinance adopting the 3 Mile Lane Area Plan and its appendices as a supplemental document to the McMinnville Comprehensive Plan and amending the McMinnville Comprehensive Plan, Volume 2, Chapter 6, Transportation System to add a proposal.
Thank you. I would now call on our planning director, Heather Richards, to present.
Thank you, Mayor. I am going to share my screen with you, I believe.
Heather, could you put your mic a little closer to you?
So tonight, ordinance number 5126 has two actions associated with it. It's comprehensive plan amendments. One is adopting the 3 Mile Lane Area Plan and its appendices as a supplemental document to the comprehensive plan, and the other is a text amendment in Chapter 6 of Volume 2, which is called Transportation, by adding proposal 20.05. 20.05 reads that the comprehensive plan map amendments and any associated rezones consistent with the 3 Mile Lane Area Plan can be initiated by the city or property owners through future map amendment applications, at which time any necessary changes to the McMinnville Transportation System Plan would need to be made. Until the comprehensive plan map amendments are adopted for individual properties, the properties would continue to be subject to the use provisions of the current comprehensive plan map and zoning map designations and provisions of any property-specific plan development overlay zones. So what those two items do is it adopts the 3 Mile Lane Area Plan as a guidance document, and it doesn't actually change the comprehensive plan map or the zoning map at this time. Those will be future land use applications and decision-making processes. And then at that time, when those processes are undertaken, and if the TSP needs to be amended to support them, then the TSP would be amended at that time as well. The 3 Mile Lane Area Plan document that we're recommending for adoption is dated November 8th, 2022 final, and it includes amendments that have occurred through this public hearing process. We provided for you a document that's a red line document that shows all the amendments made during the City Council public hearing process, and then in the staff report, it shows the 2 amendments that were made during the Planning Commission public hearing process. The 3 Mile Lane area is 1,340 acres of land, and as we shared with you as we've gone through this, this land is all in the city, and it's all zoned at this point in time, so it's not a question of if it will develop, it's how it will develop. And the question was asked, how can this area best serve McMinnville now and into the future, and the future planning horizon being 2021 to 2041. We have to plan in 20-year increments. So when we visited with you on September 13th, we talked about vision, land use, and infrastructure. The vision is what is this property going to do to serve McMinnville moving into the future? The second question we asked, does our planning program support that vision? Does the current comprehensive plan support that vision? That's the land use plan. And then the third question we asked, how does that future vision impact the state and local transportation system, because this area is bifurcated by Highway 18, and that's the infrastructure discussion. The land use vision itself, we've talked a lot about. This is a map that represents that. It's a conceptual map, but it's looking at responding to McMinnville's needs for affordable housing by introducing more land for high-density housing. It's looking at responding to McMinnville's needs for good jobs by bringing online a concept which we are calling the Innovation Center or the Innovation Campus. It's looking at providing more commercial options for the community as the community grows to a population of 45,000 people by introducing a mixed-use town center. It's looking at the opportunity for the healthcare industry to expand around the hospital by introducing a healthcare campus in that area. And then it also brings in open spaces, trails, bike ped connectivity to the parks and amenities that are in this area and also into the downtown itself. And it supports tourism with a couple of tourism-specific land uses that are on the northern side to support what is already occurring there. After going through the land use vision process, we then evaluated our existing comprehensive plan map to see if it would support that vision. We identified 3 areas where comprehensive plan map amendments would need to take place in order to support that vision. That was a total of 79 acres, which is about 5.6% of the overall acreage in this study area. We then looked at the transportation system to see if the vision impacts that significantly. And what we learned after going through updating the transportation model for the city of McMinnville with ODOT and doing a couple of transportation scenarios, we learned that it still maintains Highway 18 as a state expressway and freight route and meets all the mobility standards for those 2 classifications. It meets the Oregon Highway Plan mobility and access standards. It follows the 1996 Oregon Highway 18 Corridor Refinement Plan. And then the improvements that are in this plan will be required if the plan is adopted or not, because the land use vision is such a small lever on the dial, that 5.6%, that these improvements will be needed just to develop that land to 2041 in that population of 45,000, even if the 3-mile lane area plan is not adopted. So this shows existing conditions for that area, and we've walked you through these maps and talked to you about access and mobility standards and how we look at level of service and our focus on intersections on Highway 18 as we're doing so. These were existing conditions in 2018 for the PM peak hour, which is the 30th busiest hour of the year. Excuse me, there's a typo on there, I apologize for that. And then we looked at what does the system look like in 2041 when we build in the population growth to 45,000 people, and we developed the land per the existing comprehensive plan. And you'll see that the level of service is 0.74 and 0.63 at the 2 primary intersections of Norton Lane and Cumulus Avenue. And then we brought in the land use vision that came out of this process, and we did a transportation scenario associated with that, and that changed those 2 numbers from 0.74 to 0.76 and from 0.63 to 0.64, still meeting the mobility targets for Highway 18 in terms of access and mobility. The most controversial element of this plan has been the commercial rezone discussion. The recommendation in the plan was for 40 to 60 acres. It was based on 33 net acres, which were modeled in our transportation scenario, and it included set aside for public right-of-way needs, including a future interchange. Talked about the fact that we can't require the future interchange because there's no need for it in that 20-year planning horizon, but we have been in discussion with the property owners. They're willing to provide it, and we want to make sure that we set it aside for an interchange for when that's needed down the road. And that's what got us to the 40 to 60 acres. This was a plan that was presented to the Planning Commission and City Council in work sessions. We then brought it forward as a land use efficiency during our recent UGB amendment work. And then this particular 40-acre rezone became a lightning rod for this plan's public hearing process. Why the recommendation for this commercial site? It was multifold. The public process identified the need for more commercial amenities in McMinnville. We did an analysis that showed that there was retail leakage and people are shopping elsewhere to obtain general provisions. We wanted to reduce greenhouse gas emissions in terms of those overall trips that were leaving town. It's a food desert for this area in terms of the residential neighborhoods. And then it's also been a barrier for industrial development to occur on 200 vacant acres that are in the city south of Highway 18 due to the cost of the infrastructure to serve those acres. And the commercial development can carry those costs better than the industrial development. So the intention being that the commercial development can pull the infrastructure into that land, and then the industrial development can piggyback on that investment. The plan itself, there was a lot of discussion in the public hearing process, which was concerned about a large regional mall and a big box shopping center, and there was discussions about Kaiser Station and other places. The plan itself talks about a mixed-use town center. It's looking at a grid system in terms of how it's developed, so to prevent that sort of large, big box feel of vast parking lots and large structures. It talks a lot about the need for walkable streets and more dining options and gathering spaces and things of that nature. We talked about retail leakage at length. Our market analysis in 2018 showed that about $205 million was annually being spent elsewhere by McMinnville residents, and that we were concerned about the numbers we were seeing for both general merchandise and restaurants, which was $95 million and $30 million respectively. There was questions about how much of that was actually online e-commerce, and we went and did the research on that and felt that at the time of the analysis in 2018, it was about 11%, and then during COVID, it obviously went up. It went up to levels of 15 to 20%, but it's now coming back down. The studies are all showing that people are going back into the bricks and mortar shopping experience, and we think it's anywhere between 12 and 13% as some national studies, or our consulting group came back with a conservative estimation of 15 to 20%. The Friends of Yamhill County came forward with public testimony that talked about a net inflow of retail dollars. This is census data. What this shows is that actually our current businesses are doing a really good job of attracting dollars to those businesses and are healthy. What it doesn't talk about is what is the leakage itself, and are people driving out of town to achieve provisions that they can't find here. So we were asked the question of how do we dive deeper into that discussion and find that data. We did provide that data at the July 26th public hearing, where we did placer analysis. Very concerning that we can collect this information on people, but we can collect shopping habits, where we have maps showing where households are shopping based on data that's out there. And so we looked at that for a year period from July 2021 to July 2022. That encompassed some of the COVID years. And we looked at it for both the market area and then also the city of McMinnville proper. The city of McMinnville proper, in terms of our households, we have about 13,500 households in McMinnville. We had 101,000 visits, to Target in that 12-year period in Salem, Kaiser, and Sherwood. We only looked at 3 retailers. We didn't look at all retailers and all the leakage. We just wanted to demonstrate there is leakage occurring and there are trips occurring associated with that. We had 106,000 visits to Fred Meyer in Newburgh in that 12-month period, and then 70 visits to Costco in Wilsonville, Salem, and Tigard in that 12-month period. So that equated to about 278,000 trips that our McMinnville households were taking to find provisions elsewhere that they couldn't find here in the city of McMinnville. That brought us to the considerations of this plan. The plan's meant to accommodate growth through 2041, when McMinnville is forecasted to be a community of 45,000 people. So it's not meant to serve just what our existing situation is, but really meant to think about what happens when we add another 10,000 people to the community. The transportation improvements identified in the 3-mile lane area plan will be needed whether this plan is adopted or not adopted. Those are transportation improvements we'll need just to accommodate the growth of the community and develop the land as is. Highway 18 is predicted to get more congested. I think people need to understand that. There will be more cars on Highway 18 as time goes by. I feel fairly confident with that prediction. Whether this plan is adopted or not adopted, but the modeling shows it still achieves the mobility standards of the Oregon Highway Plan for an expressway and a freight route. So it still operates as intended. The plan was developed by a project advisory committee, and it was recommended to the city for adoption. It was reviewed and recommended to the City Council for adoption by the Planning Commission. The plan was endorsed by the Oregon Department of Transportation, the McMinnville Chamber of Commerce, McMinnville Economic Development Partnership, and then Friends of Yamhill County and Thousand Friends have expressed their opposition to the mixed-use town center, the commercial site. Encourage their membership to do so as well. And then residents not affiliated with any of these groups testified and appeared to be divided in their support and opposition to the plan. So we heard from a lot of different people with a lot of different stories about what they felt what they were supportive of and not supportive of in terms of the plan outside of those groups. The plan is compliant with state land use goals, it's compliant with the state and local transportation standards, and it's compliant with the McMinnville Comprehensive Plan. And then adopting the plan is now a policy decision for you, the City Council. In September, we talked about looking at it from a perspective of vision, land use, and infrastructure. So the question was asked, do you support the vision for the area? Do you feel that the land use plan represents that vision? Do you feel like the infrastructure supports the vision? And do you feel like you've had enough data to make those decisions? And we went through this matrix here to sort of walk through those different decision-making filters. And you had a discussion and deliberation, and I feel like you fell in this area here, which was that you've supported the vision for the area, but you weren't quite sure if the land use alternative represented that vision, and you gave city staff the direction to go back and make 5 amendments to the plan. Those 5 amendments were clarify that commercial site would be 33 net buildable acres as modeled in the transportation scenario. So we added language to the plan document in 3 separate places where that acreage is actually discussed that said that's not to exceed 33 net buildable acres, net being all acreage that is buildable and not encumbered in the public domain. And we added those to pages 19, 20, and 40. The second direction you gave us was to reduce the size of the mixed use and commercial developments that are subject to a planned development overlay from 10 acres to 5 acres. So one of the implementation recommendations was that mixed use, commercial, and industrial developments, 10 acres or more, we go through a planned development overlay process, which means they would be reviewed by both Planning Commission and City Council as a land use process. You gave the direction to reduce the size for both the mixed use and the commercial from 10 to 5. That was done. It's an amendment in policy number 1 in table 4 under the implementation recommendations, and that's on page 46 of the plan. You asked to add a policy to consider public safety services when master planning in the study area. We added policy number 22 that states public safety services shall be considered as part of master planning, including access, response times, and opportunity for substations if needed. And you can find that on pages 38 and 50 of the plan. You asked us to add a policy that proposes rezoning the M2 industrial land to, that's associated with the Innovation Campus to M1 industrial land. We added policy number 23 that states ensure that no incompatible heavy industrial uses are allowed along Highway 18 in the 3-mile lane area as part of the Innovation Campus. And that can be found on pages 38 and 50. And then you asked us to add a policy to inventory and protect significant natural features as much as possible in the study area. And we added policy number 24 that states natural features shall be inventoried and protected as much as possible within new development plans. That's on pages 38 and 50. Those policies were then added to that implementation recommendation table, which is table 4, and it's found on pages 46 to 50 in the plan. That recommendation table talks about what should be in an overlay amendment moving forward, and then what are some future actions for the city to take to make sure these policies are realized. And so you'll see the recommended future actions associated with those policies to make sure that they move forward as appropriate. So the public safety services policy has a recommended future action that plans that are looking at going through a plan development overlay and master planning will need to meet with public safety partners to assess needs in the 3-mile lane area, ensure that future master planning addresses those needs. For the incompatible heavy industrial uses, that we rezone the M2 land to M1 land in the Innovation Campus. And for the protection of significant natural features, that one, we need to first define what natural features are that need to be inventoried, and the required developers to provide an inventory of those natural features as part of their land use application, and then how they're going to protect them, and the ones that they can't protect, why they can't protect them. And then that will come to you as City Council as part of that land development, land use action. Documents for the record we have provided to you a red line document of the 3 Mile Lane area plan, as I described, that shows all the changes made during the city council process. Ordinance number 5126 has 3 exhibits associated with it. The first exhibit is the 3 Mile Lane area plan dated November 8th, 2022, marked final. That's Exhibit A, and then all of its appendices. Exhibit B is the comprehensive plan proposal, so that's the text amendment for that proposal 20.05. And then Exhibit C, 3 Mile Lane area plan findings. That's a new document that we provided to you after getting your direction on September, understanding where you want to go with the plan, and then we put together a findings document to show how it met state land use laws, state administrative rules, state land use goals, and then our local regulations as well. We also provided you a memorandum dated November 7th, 2022. I put together the findings after being sick and wasn't able to get to Bill in time for him to review it before it got to you. So he had an opportunity to review it after it went out, and there were a couple of minor amendments that we made to the plan. We don't feel they were substantial, to the findings document, we don't feel they were substantial, and those are memorialized in that memorandum that you received on November 7th. That are also in the record. And it looks like there was 5 of those. We also want to make a grammatical correction to Ordinance 5126. Claudia is passing out the paper copy of this. In your 4th whereas statement in the ordinance, we are missing the word acre. We've highlighted it here on the slide, but it should read, whereas after several public open houses, focus groups, design charrettes, and surveys, the citizens of McMinnville developed a 3 Mile Lane area plan that addresses McMinnville's future needs for affordable housing, high-density jobs, and additional commercial amenities in a 1,340-acre area of McMinnville, commonly known as the 3 Mile Lane area. So with that, that's the background on ordinance number 5126. Happy to answer any questions you have, if you have any.
Thank you. I'll open the floor for council discussion. Councilor Peralta?
Thanks, Mayor. Thank you, Mayor. I'm just trying to go through my notes here. Heather, I really appreciate the genesis of this and the responsiveness that you've had to the different concerns that have been raised at the dais. I've got a question about how this fits into our comprehensive plan, and in particular, the town center. I have to admit, I wasn't as familiar with the comprehensive plan as I probably should be, but one item that I found is Goal 4, subsection 3, that relates to this kind of development. And Goal 4, subsection 3 says that we want to ensure commercial development, maximize efficiency of land use through utilization of existing commercially designated lands, through appropriately locating future neighborhood serving and other commercial lands, and discouraging strip development. And so I guess, can you speak to the town center in light of that particular goal?
Yeah, so, and we looked at that. So what that goal is looking at is, are there lands within the city as it is zoned commercial that would serve the intent and purpose that this proposal is meant to serve, right? And in terms of redevelopment or vacant lands. And going through our commercial buildable lands inventory, we don't have a lot of vacant commercial land. There might be opportunity for some redevelopments of some of the older strip malls along Highway 99, but they will still be strip malls along Highway 99 because that's not deep frontage. A lot of that is just singular parcel frontage on either side of it. And the intention behind this commercial site is multifold. So one is to bring in commercial amenities that are not here, and it's clear there's data that people are not finding what they need here. I think that's indisputable. It's just a question of whether we want to provide it or not. 2, the intention behind the mixed-use town center is not to have a commercial strip. It really is intended, the design and development standards and how it's described in the plan in terms of the policies, is it really is meant to be more of a walkable environment with that grid pattern that you mimic for something like this historic city center here, but probably a bigger grid pattern, and more depth in terms of the land that's associated with it. And then the third purpose behind the commercial site is really that function of helping to incentivize the development of the industrial land around it. So looking at the highest and best use for the land that's just there adjacent to Highway 18 at Cumulus Avenue and the intersection there, that's been there for 40 years. And it has not developed, and there's reasons why it hasn't developed. It's just very expensive to serve with infrastructure, and probably the most expensive, we haven't done the entire study on this yet, is the transportation improvements to protect Highway 18 as a throughput facility. So there will be a lot of local roads that will need to be built to support that development. And I've only been here 6 years. My understanding after talking with Jody is that this happened previous to that as well, but I've seen many industrial developments look at that land and walk away from it once they started figuring out fairly quickly what the infrastructure costs would be to support it. It just didn't pencil out for industrial development. And so that's the other intention behind that commercial site.
So the point of the commercial site, as we've discussed, is to essentially fund the infrastructure that's needed for the industrial.
I would say that's a piece of the pie. The pie has many other pieces in it as well.
Got it, yeah. So the other question I have about this center and the relationship to the Innovation Center is the compatibility. I wonder, I've heard in the last several months, people suggesting that might be a location, a potential location for a recycling, like moving the Recology recycling space from Lafayette Avenue out to Highway 18, which seems to have a lot of virtues just to get that out of the city center and onto Highway 18. Have you heard any conversations about that? And if that, would this use that you're describing, this town center, be consistent with something like that?
So I haven't heard the discussion of relocating the whole transfer station out to Highway 18. There is public hearings, there is public testimony submittal that we received at the very end when we closed the record on August 15th after your last public hearing on July 26th from both Ramsey McPhillips and Troy Severson. Am I saying, is that Troy? Who both talked about the opportunity might be there for this particular type of, someone help me with what it's described as. It's organic matter eating organic matter enclosed in a building. And some of that happens out at the Recology site, but it's not the whole transfer station. We did talk to them. We met with Chapoul Farms, excuse me. We did meet with the gentleman who's running Chapoul Farms to learn a little bit more about his product and if that site's a good site for them. Their product is fascinating, and they're looking for sites around the United States to place it. That's all, what they do is all encumbered inside a building, because we did have questions about compatibility with other industrial development in the area, the whole interest of this campus and the commercial piece of it. And after the discussion with them, I think everyone at the table felt that it was compatible because it was enclosed all in a building in terms of what they did. I haven't heard of the transfer station discussion transferring out there, have you?
Okay, so, but in the case of, say, Chapoul Farms, you're talking about organic waste potentially being trucked in. And so, I mean, I guess my question is, we're talking about a city center, a commercial center being sited with some kind of industrial. And I guess I'm wondering how good of a fit the type of commercial that we're doing is for any type of industrial in there. I mean, I get the need to pay for the infrastructure, but I'm questioning whether the type of retail that we're putting in there will actually support. I mean, because honestly, when I heard about Innovation Center, I went and looked at innovation centers around the country, and I don't see any that are situated like this one. They're next to college campuses, they're next to research universities, they're next to massive hospital facilities. So I'm trying to figure out how these two pieces fit together.
So I guess I'm hearing two different questions in there.
Right.
One would be the compatibility of a commercial development adjacent to industrial development. And then two would be the actual location of the innovation center in that concept.
Yeah, I mean, I'm trying to wrap my head around the fit between these two.
I would
Seemingly
suggest,
disparate.
so if commercial development along highways and expressways is very common in front of industrial development. You see that throughout Oregon. And there's two reasons for that. One is what we just described, is it's carrying the infrastructure, right? So the industrial development gets access, but they don't have to pay for the infrastructure, and commercial is getting the infrastructure there because they need the visibility. Industrial development does not need that visibility.
Right.
And so you can see that all along different expressways throughout Oregon. And the industrial development today, most of it is internal. So all the sort of incompatible, hazardous type of materials and things like that, that's all managed in an internal way. Chapel Farm is a little bit different. And so I guess I would say, in terms of Chapel Farm, I would have concerns. If there's concerns about the organic waste and how it impacts the commercial site, I would suggest there should also be concerns about that organic waste and how it impacts that other 125 acres of industrial campus we're trying to build there, right? To me, the industrial campus compatibility with the commercial site, it's similar. I think that's very compatible. But in terms of the location of the innovation center, yes, I think you will find that innovation centers are typically anchored by educational anchors, especially here in Oregon. That's been the historical trend behind it. But they're now what they're trying to do is make it more of a industrial land focus, and then bringing those entities in as partners, the academic partners to the site. And so I think there's a lot of excitement about this particular site throughout the state in terms of being able to serve as an innovation hub. I guess I would call it more of an innovation campus, because really what we're trying to do is respond to the need in McMinnville of having sort of a campus standard for industrial development, research and development, and office space that we don't currently have here. And that we learned was an issue when we had businesses that were located in the downtown, headquartered in the downtown, so in Springs Living and TTR. And when they outgrew those downtown spaces, which were good spaces for them to be in, that's the environment they wanted, they had nowhere else to go in McMinnville. They couldn't find other space until we opened up the space at the Evergreen campus buildings, which were industrial, and we had to squeeze them through the land use process. But we recognized in that process that we really don't have that sort of next level to support our businesses, and that was that campus concept. That's where it first came from.
Thanks for answering my questions, Heather. Appreciate it.
Any other council discussion? Councilor Geary.
Couple of specific questions, if I may. The PDF page 29, when circling back to what I always circle back to, that pedestrian bridge, can you explain when it says the city should continue to evaluate the need? Basically, I'll summarize the second part of that. That's highlighted in the box, the future bicycle and pedestrian overpass consideration. The second part in there sets us up as the one to continue to evaluate the bicycle and pedestrian movements. Can you tell me what the plan will be for that? How we will do that? If we're the best people to do that, what are the metrics for we need it now?
Yeah. So what happened was at the Planning Commission level, this came through in public testimony, and the planning commissioners asked the project management team to study it. And so the transportation consultants and ODOT got together and studied it. The need isn't there for a pedestrian overpass right now. So there's an emotional need for it right now, but the data's not showing the need for it. And so those two entities, ODOT and the transportation consultant, did not feel comfortable saying this is a need and mandate it into the capital improvement program. The Planning Commission still wanted it to be on the radar screen. They wanted to make sure that we were thinking about it, that we were continuing to look at it, that we were evaluating the data as things continue to grow in that area for when that need existed, so that we wouldn't lose sight of that as a potential future capital improvement project. There is, I think I shared this at another meeting, there is some concern from transportation experts that if you put up a pedestrian overpass right now, when you have a signalized intersection out there, you're creating two opportunities for crossing. But if you're gonna design the signalized intersection not to be supportive of pedestrian crossings, but people are still trying to cross it, because people don't like to go up and then down, they like to go across if they can, you're creating an unsafe situation, and that was the concern in that regard.
Right. Can you tell me what the plan is for the city to,
Yeah, so
and what the threshold will or if would be?
Presumably, we're supposed to be updating our TSP every 5 years. And so when a community goes through a TSP update every 5 years, you're constantly now pushing that transportation data again, right? So when you do a transportation system plan update, you're looking at future growth again, you're looking at your system, you're looking at you're collecting data as to the trips that are occurring, and you're running the scenarios again. It's sort of like truth checking it, right? We don't update our long-range plans on the level that we should, that the state's recommending. But the TSP, we're updating that here shortly, and it will be after 10 years. That's pretty good for McMinnville. And so if we consistently keep in those plans and programs and do what we should be doing, which is updating these things in a systemic way, then we're going to identify the time when that will be needed to be put into our capital improvement program. And we should identify it years in advance. So the whole reason we do a 20-year planning horizon is because we want to start planning for and collecting funds for those improvements that we're going to need 15 to 20 years down the road.
Yeah, so what I hear you say is at the next transportation plan, we will come up with the methodology for the improvements we want to make and a method on how we'll pay for them. So if that's the answer to the question, how will the city continue to evaluate the need for the bicycle and pedestrian bridge? You're saying that we're going to include that in the thinking for the TSP based on this language. Well, we should or we will?
We will. So adopting this language says the city's going to continue to evaluate. This will be informing the TSP. And so we should look at it in our current TSP update. I suspect you're going to find the data is not going to support it still. But we'll still want to keep it in the lens. And so maybe we bring this language into the TSP as well so that we continue to look at it.
And that dovetails with this next question was about the traffic modeling was done prior to the passage of the UGB, correct?
Yes.
And so can you tell me about the pitfalls or just sort of what would that cost have been to update that methodology or now to update that based on the methodology and hazard a guess as to what, if anything, would change?
Yeah, so when
after we've updated
Friends of Yamhill County brought that up as a concern during the Planning Commission public hearing process, and so I went to ODOT and the transportation consultants to see what it would cost to bring that into the transportation modeling. What we would need to do is update the whole City of McMinnville transportation model first, and then we would need to run the transportation scenarios second. So updating the model would take about 6 to 12 months based on when we can get it into their work plan. And then running the transportation scenarios, they guessed it would be anywhere between $60,000 to $100,000. Now, we are intended to update all of this with the transportation system plan update. So with that just 2 years, in our next step, DLCD and ODOT both came back with the recommendation that you did not need to do that for this area planning process. It didn't make sense. In terms of the growth horizon, we looked at a growth horizon of 2041, which is the same growth horizon we're going to use for the TSP anyways, and it has the same population standard that we use for the 2023 UGB update. So I don't remember the numbers exactly, but it's between 45 and 46,000 people that we're planning for in all those planning horizons. So that in and of itself also told people it's not going to be significantly different. And the other thing that happened with the UGB update is only 27 acres was brought in this 3 Mile Lane area. Those 27 acres, for the most part, the the landowners looking at putting those in vines and then also putting a road through them. So there isn't going to be a lot of impact associated with that in terms of additional trips. And where we're going to see a lot of trips is in the southwest area and the impact to Highway 18 over there where Keyvine, I think, Durham Lane, and then the next entry point into Highway 18. That's where we're going to see transportation impact that I think we're going to be struggling with our TSP update.
So things like that, like the Housing Authority project that went in, those numbers are figured in there. Interesting. The next one on PDF page 30, our goal 4 list, under number 1, natural feature preservation, we still have the strive to protect tree groves and strive to protect individual trees. I remember some discussion around the weakness of the language strive and perhaps putting in shall. Can you talk to us about the difference between those two? And
yeah, so those are policy statements to respond to the Great Neighborhood Principles. For us to create an inventory, if you recall when Winterbrook came and did a work session with City Council on our natural resources inventory that we were working on, so tree groves, scenic views, things of that nature. For us to create an inventory of natural resources that we're going to protect and say to the property owner, you can't cut these down or impact these with development. We need to go through an analysis per Oregon land use goals to say that we're taking that off the buildable lands inventory, more or less. And so we haven't done that analysis. We've done it citywide. We haven't brought it to you yet as an inventory. So we can't put that sort of language in a policy statement like this if we can't support it with the background data to support it. We wouldn't have findings for that. So we have Goal 5 and Goal 7 work that we've been working on due to the, staffing levels and planning being at 50% for the last 2 years. That work is sort of trickling in. We've done the inventory, we've done the easy analysis. We had a work session with you as City Council about it. There were some concerns, I understand, from that work session as to what we had put into the inventory. So we still need to bring that forward through a public hearing process and adoption, and we haven't done that.
Okay. Those are my questions, Mayor.
Thank you. Any other questions or council discussion? Councilor Chenoweth?
I just would like to say I am very pleased with the entire community engagement that occurred through this process. I'm very pleased with the work that the planning department has done through this process. I'm very pleased with all of our counselors' in-depth thought, and I'm very pleased with the outcome. And so I just want to thank all that have been involved to get us here, because this has been a long road that we have taken to get to this place that we're going to be discussing an ordinance. So thank you to all that have gotten us here.
Thank you, Councilor. I will now ask for a motion to pass ordinance number 5126 to a second reading.
First reading, right?
I'm sorry. Yes. First reading. No, I'm sorry. No, to.
That's the first one.
Yeah, that's
The first reading has occurred, so the vote
I guess
to approve it and
Yes.
pass it on to the second reading.
Okay, I apologize. So moved.
Thank you.
Second.
Okay, I have a motion from Councilor Chenoweth and a second from Councilor Menke. All those in favor, please signify by saying aye.
Aye.
And those opposed signify by saying nay. The motion passes unanimously. Ordinance number 5126 has passed on its first reading unanimously. I will now ask our legal counsel to read the ordinance again by title only.
Ordinance number 5126, an ordinance adopting the 3 Mile Lane Area Plan and its appendices as a supplemental document to the McMinnville Comprehensive Plan and amending the McMinnville Comprehensive Plan, Volume 2, Chapter 6, Transportation System to add a proposal.
Okay, I'll now ask for a motion to adopt ordinance number 5126.
So moved.
I have a motion by Counselor Chenoweth and a second by Counselor Menke. I will now ask the city recorder to poll the council.
Counselor Geary,
Aye.
Counselor Minke,
Aye.
Counselor Chenoweth,
Aye.
Counselor Payne. Aye. Counselor Peralta.
Ordinance number 5126.
Council President Garvin.
Oh, my gosh.
Aye.
Ordinance number 5126 is adopted by a vote of 5-1. I will now adjourn this city council meeting at 8:05 PM. Thank you all for your service.